Greetings, everybody, and welcome to Medicare 101, the ABCs of Medicare. We try to make this easy for you, and we do that by going over what Medicare is, what does it cover, what it will cost. We explain the parts, how each part works. Medicare Supplements, Advantage plans, and drug plans are the three emphasis that we have on this. We also want to help you figure out how to select the right plan for you based on your needs and your budget. Don't let somebody talk you into a one-size-fits-all by watching some commercial and then calling in on a commercial. We'll teach you how to pay less and get more, compare plans side by side, and to know what to look for. We also want you to know when it is time to change. And if you understand this, then a lot of the fear goes away. Now, this is a little illustration we did. Most people are really upset about the phone ringing over and over again. And yes, I'm 68. I aged in 3 years ago. I'm still getting these silly phone calls. So there's some ideas that we'll share with you on how to block some of those calls and how to make this easier. So we basically, the whole point of this is to make Medicare easy. And that's why I'm going to move through this quickly so it's not a real long presentation. Medicare's health insurance, it's a federal program started in '65 by the Johnson administration, and the CMS is the ruling body. It's financed by your payroll taxes. You paid for this over your entire life. The people who are responsible are you if you're over the age of 65 or aging into Medicare, if you're under the age of 65 with certain disabilities, or if you're any age and you have end-stage renal disease. You're eligible for, if you're under 65 with certain disabilities, if you've been on SSI for 24 months. And if you are disabled, you know what I mean by SSI. The four parts to Medicare: hospital, medical, Medicare Advantage, and prescription. That's what we're going over. There's a Part A and a Part B. First of all, these two parts are crucial. Part A is your hospital coverage, and Part B is your medical coverage, doctors and all that kind of stuff. So let's go over what Part A pays for. It's inpatient care, skilled nursing care, home health care, and hospice care. That's not skilled nursing care in a nursing home like long-term care. Medicare does not pay for long-term care like nursing homes. Original Medicare, the cost is $0. You've already paid for Medicare Part A. So the hospital part, you have no premium. Part A also has a deductible of $1,484. So the first couple of days you're in the hospital, it's a $1,484 deductible. And every 60-day period, if you get treated in the hospital and then there's 60 days pass without you getting treated, then there's another $1,484 that you have to pay every time you go out of the hospital and come back in. It's rare for people to go through that. Then there's the original Medicare costs. Part A, the co-insurance varies, meaning your part, the 20% that you pay. Now, let's go to Part B, medical. Original Medicare cost premium for Part B is $148.50 a month. It can be taken out of your Social Security. You can set it up so that it's an auto pay out of your own, whichever way you want to do that. If you're aging into Medicare at the same time that you're taking your Social Security, or if you've already taken Social Security, then it will automatically sign you up for Medicare. Most people, though, are not already in Social Security when they age 65 because most people want to wait until they're 66 to take Social Security. So in that case, if you haven't already taken your Social Security, then you're going to have to sign up for it yourself. It's pretty simple. It's an easy call. And once again, that's something that we can help you with and make it easy for you. The original Medicare cost for the deductible for Part B is $203 annual. Let me just say this. You have never seen in your entire insurance life a $203 annual deductible. That is amazing. That is low, low, low. Most of us are used to $2,000 and $3,000 and $4,000 deductibles, and some of us $6,000 and $7,000 and $8,000 deductibles. But this is for Part B. The co-insurance, the part you pay, is 20%. Medicare pays 80%. You pay 20%. For doctor services, lab tests and x-rays, outpatient care, some preventive services, and other services and supplies. Basically, Part B pays for just about everything that the hospital doesn't pay for. But the Medicare does not pay all of your health care costs. That's why they have a thing called Medicare Supplements. You see, that 20% can really bite hard. So if you get a Medigap or Medicare Supplement plan, you can get rid of that extra 20%. The coverage levels vary by plan, and there are plans A through N that are regulated by the government. They were standardized in 1982 to make easier price comparison. The plan benefits are absolutely identical. If somebody has a plan A, it's identical to somebody else's plan A. There's no difference in coverages. The only difference is how much they're charging you. So that's it. The plan premiums do differ. Now, the Medicare supplements were modified in 2010 to make it easier and less complicated. It created what's called cost-sharing plans. But here are the basic Medicare supplement plans: A, B, C, D, E, F, A, B, C, D, F, G, K, L, M, N. And you'll say all the way at N, you're basically paying for most of it yourself, whereas G and F in the middle, they pay for just about everything except the deductible. Now, you can no longer buy Plan F, so let's not worry about Plan F anymore. Plan G does not pay your Part B deductibles. So the only thing that's coming out of your pocket for Part B is going to be just that deductible, that $203 per year. Medicare supplements have to be accepted by any doctor who takes Medicare. It is priced by your area or it's age-related, and it is guaranteed renewable. That means your coverage can't be terminated by the company unless you commit fraud or you don't pay your premiums. And since you are currently aging into Medicare, nobody can ask you health questions to see if you qualify. That's only when you age into Medicare, so you only get one chance to get past those medical questions. Keep that in mind. Medicare supplements you must health qualify unless you're in open enrollment, which is what you're in right now. So most of the time, they're going to ask you health questions. And like I said, if you're aging in and you're turning 65, they can't ask you those health questions. Now, we're going to talk to you a little bit about how to select the right plan. But what we're going to do is, if you fill out this little sheet, and if you're online looking at this, you'll see the sheet. It's a personal evaluation that we do, an unbiased guide. It's based on plan data, and we use our computers to compare all, that word, all Medicare supplements. So we're looking at what fits whatever profile you give us. Here's an overview. Part A, original Medicare, plus Part B, plus Medicare. Part A and Part B handle your hospital and other medical costs, and the Medicare supplement handles that 20%, that part that really bites hard. You don't want to get hit with a bill after you get out of the hospital for $10,000 or $5,000 or $20,000. So you can see that we haven't talked about Medicare Advantage or prescription benefits. Now, prescription drug coverage is the part that just about everybody who works in my industry tries to avoid. They skip over this. They leave it for you to figure out, partly because they're paid very little chump change to go over this with you and to help you with it. Our company is committed to going over with this with you and helping you with it. This is the prescription drug coverage is done by private companies. You have to already have Part A or B. You enroll every year from October to December 7th, so you can't enroll any time of the year. And there's also plans that give you extra help through SSA, and that's an unusual plan, but that's something that some people do qualify for, usually people in the poverty range. Now, Part D, your prescription drug coverage, does have a late enrollment penalty. It's 1% of the national average standard plan premium added to your monthly plan premium. And this is an indefinite amount because it can change. Trust me, you need a Medicare prescription drug coverage benefit. You must get this. You don't want to pay those penalties. Now, the prescription coverage for Part D has varying plans. The costs vary wildly, and it's sometimes difficult to choose the best savings, but that's why we have help available for you. Now, here's how you select the right plan. Once again, submit the sheet of paper, fill it out. It's an unbiased guide that we do for you. We will run your personal evaluation. We will get an unbiased plan, and we will compare all drug plans using your drugs. It's very important that you understand that it's complicated because everybody has a different drug situation. So that drug profile is absolutely important. Part A and Part B now, and the Medicare Supplement and Part D, now you're complete. You can see you've got all 4 parts that you need. So that is path number 1. Medicare Part A and B with the Medicare Supplement, and then you add your prescription drug payment. So let's go back to the 4 parts: hospital, medical, Medicare Advantage, and prescription. We haven't talked about Medicare Advantage, have we? So let's start talking about Medicare Advantage. Medicare Advantage replaces original Medicare. Medicare Advantage, or Part C, has hospital coverage, medical coverage, and prescription drug coverage. It replaces original Medicare. Part C is not, you're no longer dealing with the government. Now you're dealing with those wonderful insurance companies that we all love so much. And as we all know, they limit you to HMOs or PFFSs, private fee-for-services, or PPO, preferred provider organizations. In other words, they tell you their network, and you better stay in network, or you're going to find that your costs are much higher than you anticipated. You must use their providers. If your doctor's not on their provider list, you need to find a different carrier or get a different doctor. The providers can accept you on a case-by-case basis. They can change yearly, and the plans can discontinue. Doesn't that sound great? The Medicare Part C is also referred to as an HMO, a fee-for-service, or Medicare health plan. Okay, let's stop right here and talk a little bit about Medicare Advantage. One of the problems with talking about Medicare Advantage in what is called an information or educational meeting is that you're not allowed to, I'm not allowed to go over prices and make comparisons between companies. That would be a marketing meeting. So I'm going to be very careful to obey the Medicare guidelines. So just in rule of thumb, early in my career, I was signing up just about everybody for a Medicare Advantage program because I was going to these events where poor people could come get food. And most of the people who were looking for a Medicare Advantage plan already have what's called TennCare or Medicaid. So if you already have TennCare, you qualify for what's called a DSNP, special needs program. And it basically pays for everything and adds some dental, some vision, gym membership, things, nice things to have in addition to the regular what Medicare pays for. Well, Medicare Advantage plan is really wonderful for these people. This group of people really, really need it, and it was really nice to sit down with them. But even still, we always go over the drugs, which becomes complicated with just about everybody. So when we sit down with folks, we want to make sure that the plan that they're signing up for matches exactly their providers, because with Medicare Advantage, you are going to be in a network, and you can choose that network by choosing the carrier. But once you sign up with a carrier, you are on their network and only their network. If you go outside of their network, then you can be charged a lot. Since Medicare Advantage doesn't promise to pay for that 20% that we talked about, that extra amount that Medicare doesn't pay for, if you're getting a Medicare Advantage plan and you're not a special needs person, then you are liable for that extra 20%. It can add up quickly, just one hospital visit or some kind of disease that you get. So it's very important to be on a Medicare Advantage plan only if you only if you're pretty sure you're never going to get sick. Because Medicare Supplement is a fixed per month cost, whereas Medicare Advantage, you're starting off with virtually no cost per month for a Medicare Advantage plan, but you might get hit with a big $3,000 or $4,000 bill from a hospital or other organization, or just from treatment. So you want to be very careful. The difference between Medicare Advantage and Medicare Supplements is that Medicare Supplement is a known amount you pay every month, and Medicare Advantage is the Wild West. You're hoping that you don't get hit with too many out-of-pocket things. One of the things Medicare Advantage plans do that is good is they limit how much can come out of your pocket. So if you have a $100,000 bill, you're not going to be paid $20,000. Many of them have a maximum out of pocket. That's what it's called, maximum out of pocket. And if you have a maximum out of pocket of $6,700, of course, that's very high. That's a lot of money to fork out in 1 year. If your maximum out of pocket is low, say $3,000 or $4,000, then it's not so hard, and you don't worry so much about being on a Medicare Advantage plan. Just remember, once you're on a Medicare Advantage plan, you cannot switch back over to a Medicare Supplement without going through the healthcare questions. And once you have a heart attack or cancer or something like that, those healthcare questions are going to keep you from getting back over into Medicare Supplement. Be very careful. I like to say people who are on Medicare Advantage that are in the middle class have some kind of crystal ball. They can somehow see into the future to see how much their costs are going to be. But for most middle class people who are concerned about mounting bills, and remember, this is yearly, so you could be hit with a $6,000 maximum out of pocket every year. So with Medicare Supplement, the fixed cost is a known cost, and you know this is how much I'm going to pay. I'm not going to have any out of pockets to pay after that. So that's the strategies you use between the two programs. But if you are close to, if you have a very tight budget on your Social Security, you might not be able to afford a Medicare Supplement anyway. So you will be on a Medicare Advantage plan. And in which case, we try to help you, guide you toward the plans with the highest star value and with the lowest maximum out of pocket. So remember that when you're thinking about, do I want a Medicare Advantage or do I want a Medicare Supplement? The commercials you're seeing are almost always Medicare Advantage. They're always telling you about these wonderful plans that have vision and dental, and those are the two magic words. That's not available through regular Medicare or Medicare Supplements. So that side of it, the vision and dental and the hearing and the podiatry, the feet, the free gym membership, those are all little lures that they'll use in those commercials to get you to say, oh, I want one of those. So be aware that if you're going to talk to somebody who's just trying to sell you one thing, they're going to try to sell you that one thing, whether it fits you or not. Original Medicare or Medicare Advantage, those are your choices. If you get Original Medicare, you get a Medicare Supplement and the drug coverage. If you get a Medicare Advantage, then that's all you need. All the rest is taken care of. So the two paths are Original Medicare plus Part B plus a Medicare Supplement plus a Part D drug plan. Whereas Part C just basically replaces Original Medicare, and you could be left with that 20% they have to pay for. Depending on the plan, there are very many different plans. So what's next? Well, what we're going to do now is hopefully you filled out that information evaluation, and we're going to run the evaluation for you comparing all the drug plans, and all the Medicare Supplements. This is the unbiased plan data that we are asking you to give us. That means that when that phone rings and you're tempted never to answer it, and I understand when we call you to give you this information you asked for, you're probably going to hang up and not answer the phone, but we'll always leave a message so that you know it's us and it's safe. And you can put our phone number in your phone right now if you want to, and that way you know it's us calling. It's 615-975-8101, 615-975-8101. If you see us calling, it's to get a clarification or to give you your results. So please turn in your sheet, do it right now. And I want to thank you for giving us a chance to come into your home and to talk to you about Medicare. Remember, there's no reason to be afraid, but I'm always cautioning people that someone who gets Medicare with and does all of the study all by themselves is a little bit like a lawyer who has himself as a client. You know what they say about lawyers like that. So be smart, get help, and we hope you'll be contacting us soon.